All right. Are you currently receiving Social Security benefits and not sure you're receiving the correct amount? Or are you about to file for Social Security, retirement, disability, survivor benefits, spouse benefits, Medicare, Medicaid, and want to make sure you're doing the right things so you don't get the wrong benefit and make sure you get everything you're entitled to, everything you paid into FICA for all those decades? Here is your opportunity. I'm going to do a live Q&A. Usually I do a topic for about 5, 10, 15 minutes, and then I do a live Q&A. But there's been a lot of questions recently, as there always are, because the Social Security Administration, Medicare, and all that is just way, way, way too complicated. And so I was part of the complication, unfortunately. Um, and I ran the third business Social Security office in the country. I've taken hundreds of thousands of retirement, survivor, disability, Medicare claims. I've helped millions of people, and I am here for you today to make sure you're getting everything. All right, so enough stalling. Let's get into some questions. Oh, one thing I want to kind of a little housekeeping. The Medicare season is coming up here starting October 1st. The new plans come out. October 15 is when you can change. As I've mentioned, I put together a team that can help with all things Medicare. I've got a lot of people reaching out to me. I'm getting a lot of emails and people filling out forms and calling and say, "Hey, put me on the list for October. I want to make sure I get everything I can in 2025. Make sure my plan is correct." So I'm getting a lot of people every day emailing me and contacting me and say, "Put me on the list." If you contacted me, I probably haven't responded yet, but you are definitely on the list. So once we get everything set up here in the next few weeks, we're going to reach out to you, and then we're going to set up a definitive time after October 1st to review your plan to make sure yours is still the best plan for 2025. And if it's not, then my people will give you your other options, and then you decide. Completely free service, but let's make sure you're getting everything you're entitled to. Okay. All right, let's get into and you can click on that little button there again, or call or email me and say, "Hey, Ed, put me on your list," and we'll put you on the list. All right, Sherry has a question. Is SSI still available, and can I apply online, or do I have to go to the office? Okay, SSI, yes, is still available. It's been celebrating 50 years this year. Are you talking about SSI though, or are you talking about Social Security? SSI is the welfare-based program that Social Security administers. Doesn't come out of regular Social Security trust funds. It's a separately through regular taxation, a welfare-based program. But yes, but you cannot do SSI online. They've been trying to do that SSI online for a long time, but there's just so many variables. But or if you're talking about Social Security, getting your retirement benefits or spouse benefits, everybody always confuses those two acronyms. But yeah, you can file online for retirement benefits, spouse benefits. You cannot do survivor benefits yet, or you can just call the 800 number, schedule an appointment, and yeah. What is an election certificate? I was told I need one. Yeah, they usually send you though. It's basically that you're going to be receiving your widow's benefits early, and just kind of Social Security doing its due diligence, and they usually send it if the local Social Security office says you need to sign it to read it and acknowledge and sign it, then they usually send it to you. I'm not sure why they didn't send it to you, but um, they should. Yeah, to start your benefit. So it sounds as though you, again, if you're talking about the surviving spouse widow's benefit election certificate, that's the only one I could think of that is called an election certificate. I don't know if anything else out there like Medicare or Medicaid. So it's probably that one. But they should have sent that to you. So I'd reach out to them and say, "Hey, I understand you want me to do this election certificate, but why didn't you send it to me?" And then you just read it, and then you acknowledge it, and they can start your benefits. So I think the claim specialist in your office that is helping you dropped the ball. Janet, husband died in 2006 at 54. He was 5 years older than me. Started drawing Windex. There we go. I just did a video on this yesterday. Windex survivor benefits in 2022. Fraud of 66. He would have been 71. Could I get delayed credits? His record also. No. because he did not earn any delayed retirement credit. So at least he did the Windexing PIA, which I talked about yesterday, with a lot of people. Um, Janet, did you have to ask for that, or you shouldn't have to? But it sounds like the person that helped you out when you filed for those benefits did their job and did the right thing, and also checked out whether there's a higher benefit on that Windexing. As I talked about yesterday, some people are saying, what's this Windex stuff? That's stuff you clean the windows. No, 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 it's a different calculation. That Janet was lucky that the person that helped her gave her those benefits. So it's an extra benefit, or she would have been losing money for a long time. But no, in terms of delayed retire credits, your deceased spouse would have to have delayed retirement to get those credits. So if someone is 68 years old and they haven't received benefits yet, and they passed away when they're 68, then Social Security can give the surviving spouse those delayed retirement credits effective that month. Um, but unfortunately, he passed away too soon. But it sounds like your benefit amount is correct, which is a beautiful thing. Yeah, let me know how that, whether, how did you know about Windex? Did you do your research, or did they do the right thing and tell you? Um, Good afternoon, Dr. Ed. I extremely appreciate what you're doing. Altruism is fine. Yeah, thank you. I appreciate it. Thank you. If Medicaid took husband's entire Social Security allotment and he dies, can his wife file on his record, and how do I do it? Yes. So he was in like a nursing home or something like that. Medicaid was paying for it, and then they take it all to pay for the nursing home care and all that kind of good stuff. But yeah, that doesn't affect you. So yes, you can go ahead and file for surviving benefits, and that won't affect you at all. And you just go ahead. Surviving benefits, they've been working on that one too, trying to make that available online, but there's just too many variables. So you cannot do that online. You have to call the 800 number, 800-772-1213, and they will take a surviving spouse claim for you online or over the phone. And does it cost anything to get help and to be put on the list? No, for my the Medicare team I put together, it is 100% free. Just click on that email. If you're going to email, just give me your name, the state you're in, because all these plans are state specific, your phone number, and say, hey, Ed, put me on your list for October, and when the new plans come out, and we can definitely do that. Or you click on that little button there, and it takes you a little form, and there's a little portion there. It says, I'm good now, but let's talk in October when the new plans come out. So either way, it's fine. And it's 100% free. It just, every Medicare insurance agent or broker in the country they don't charge you anything. If I always recommend brokers, I only work with brokers. Sometimes people use the name interchangeably, but a broker works for several different companies, health insurance companies, Medicare insurance companies. An agent, a captive agent, only works for one. So that's important when you talk to someone who says, do you work for multiple companies? Do you just work for one? If they only work for one, then guess what one they're going to recommend, right? The old Henry Ford. You can have any color car you want as long as it's black. So yeah, you just click on that, email me, call, and we can put you on the list. How does the Civil War affect Social Security benefits? Yeah. Good question. These are the questions I like. For a friend, I always like that. For a relative, for an aunt, or for the lady that lives down the street, I'm asking a question. That's what we like to hear. For a friend that has pancreatic inefficiency, can she get SSDI at 52 years old? Got all work credits, not working since June. Yes, I would definitely, if her disability, it doesn't matter what the disability is, I always say try it. Because that whatever particular disability might not be in the book definitively as a disabling condition for Social Security, but that with the medication the person is taking, it makes them unable to work, and that with the smaller issues that they think it's, oh yeah, I can work through that, but that with that and this other thing. So I would just file, and make sure you watch my videos. Let me pop up. I did let me find a picture of the videos here. And I did 3 videos. Um, I did those 3 videos, and so you just, look on, my YouTube channel, and you check out those 3 videos, and it goes into based on my experience taking hundreds of thousands of disability claims, all the tips, tricks, and secrets, and the filing procedure, and what to watch out for, and all the rest of it. So make sure you check that out when you file. All right, let's see what else we have here. Let me see if we got anything on. Can I draw off my ex if he's still living? He's retired. Um, yes, you have the ability to do that as long as you're 62 and as long as your ex is 62. Your ex does not have to be receiving benefits as long as they're 62. Here's another thing. A lot of people out there are missing money because they think that their ex has to have filed. No, as long as that person is 62, you can do what's called an independently entitled divorced spouse. And so as long as a person is 62 and you're 62, you can collect benefits. But the trick is your benefit amount has to be less than half of their benefit amount. So how do you know that? You call Social Security, you give them your ex's information. If you don't know the Social Security number, no problem. You just give them the person's name, their date of birth, as well as you know it, where they were born, and as well as you know it. And the Social Security employee can find that Social Security number, and they'll look and see if there's any more money. And if there's any more money, they'll schedule an appointment and get you their money. Yeah, and I've had a couple people call and say, well, they couldn't find the Social Security number. That's just a bad employee. I found millions of Social Security. I mean, James Smith. You figure there's millions of those, but if you get the date of birth within a 5-year period, and then sometimes if it's like a real common name, says, do you remember his mother or her mother's maiden name? And then it's, oh, there it is. And so yeah, it's easy to find Social Security numbers for people. How to know X's PIA so I can figure my life as far as retirement goes. Yeah, just that. So they won't tell you your X's PIA, which is the primary insurance amount, which is how much that person could conceivably receive, because they don't know you. So if you call up and you're currently receiving benefits and you just want to see if there's any extra money, again, you just tell them what I just said, and they'll look and see, and they'll tell you whether there's any more money. They won't tell you how much because that's giving out private information. Sometimes the customer service representative slips and tells you, but they're not supposed to. But once you provide your marriage certificate and divorce decree and prove that relationship, then you'll know what the benefit amount is. So, and sometimes even then, it depends on the employee. They won't tell you exactly how much it is. They'll just say, okay, you'll be able to get this much more money. And then you can do your own long division and figure out how much your ex is receiving. So, but that's easy. How do I become part of your Medicare team? I'm an agent in North Carolina. Yeah, just email me. Got a lot of Medicare insurance agents that want to be part of an awesome team. So yeah, just email me. Let me know. Can I draw? Okay, I already answered that. Let's see here. Going through another. I've been ignoring TikTok here so far. All right. If I already answered that one. I phoned Social Security today and found out that 55,000 K sum in 2019 income is not included in my SSDI judgment in October 2020 when I was 55. What can I do? Okay, so and found out that 55,000 in 2019 income is not included in my. Okay, so you worked in 2019 and you paid $55,000 into taxes, and 55,000 of that should have been paid into FICA as well, and that's not included in your benefit calculation. So you need to provide proof to Social Security that you paid that $55,000. So IRS records, whatever the case may be, reach out to the IRS, get proof of that. One way to maybe do that, the easiest, is particularly if you worked, Here's what I recommend everybody out there do, because your benefit amount, whether it's disability, retirement, spouse benefit, survivor, but whatever the case may be, is based on how much you paid into Social Security over your high 35 years of earnings. So if that is incorrect, if you're missing years, if Social Security has the incorrect numbers, then that means you're going to get the wrong check forever. So it's important that you check your earnings record. How do you do that? You go into ssa.gov and set up an account and all that stuff. And then when you're in there, if you see something missing, like she saw that she's had a zero there, should have been 55,000, but it was zero. The first thing you should do is, if the year before that and the year after that you work for essentially the same company, then that's usually an easy fix. What it is that missing $55,000 is what's called a suspense file. It's just sitting in their limbo because somewhere along the way somebody typed the name in wrong. Usually typed in the Social Security number wrong. It should be 1 2 and they typed 2 1 or something. So that's super easy to fix. So you call Social Security and say, hey, I worked for the same company the year before, the year after. And then Social Security will look at the EIN, the employer identification number for that particular year, and they'll look at the suspense file for that employer. And they'll say, hey, there's $55,000 sitting out there, and that's unclaimed. And I can see the Social Security number is just somebody typed it in wrong. So they will take that money out of the suspense file, stick it in your file. If you've been receiving benefits for the past 3, 4, 5 years, they will recalculate your benefits to make that increase. So that's the easy way to do it. If you didn't work for the same company before or after, and it's not in the suspense file, then you need to reach out to the IRS, or if you have your IRS records for that year, and say, hey, I paid that money, and they will correct it. Hopefully they correct it. So there's that. When I started receiving widow's benefits, I was told I could get it until I reach full retirement age, which is coming up. Because my own benefits is much smaller, will I be able to get both? No. So you will get those survivor widow's benefits forever. I don't know why they told you will get it until your full retirement age, because you'll get it forever. If your benefits on your own record is more, then at your full retirement age, you can switch to your own, or you can wait till 70. If your benefits continue to increase, which they do 8% every year until you're 70, from your full retirement age until 70. But no, you can stay on those widow's benefits forever. Again, I would reach out, and unless you know for sure that your benefit amount won't on your own record won't be any more, but because you won't get both. Sometimes you do, but it's one minus the other. So you always get the highest benefit minus the other one. So you get 2 checks, but it's one benefit amount. So Keith, I just got approved for disability. Well, congratulations. If I decide to supplement my income and get a job, how much can I earn and not affect my disability income? All right, so that's a long one there, and make sure. Let me find. I did 2 videos on that, so check out these 2 videos, and it goes into gory detail about working and receiving disability, and working and receiving SSI, which is the welfare-based program. So check out those videos, and it gets into the trial work period, the extended period of eligibility, ticket to work, SGA, trigger months for child work periods, and it's all long and convoluted and way, way too complicated, but there it is. So make sure you watch those videos there, and or probably in your case, if you're probably not receiving the SSI. So if you are, then watch both. But so there's that. And congratulations on getting approved for disability. I know it was a long, drawn-out process that shouldn't have been that difficult, but trying to make it easier here. As of 2025, you need 40 work credits. I'll be full retirement age this time next year, and I thought it was 35 if born in 1950. Nope. It's the 35 is the high 35 years of earnings. That's what they use to calculate your benefit amount. But you do have to have 40 quarters of coverage. 10 years paid into Social Security. So yeah, the 35 is probably, the high 35 is what yeah. How many credits credits you need to get as you could have as little as 6 if people become disabled very, very young. They calculate it different, but most people, same type of thing, 40 quarters of coverage, 10 years. And then they determine it, based on how much you paid. So, and with Social Security disability insurance, there's 2 insurance statuses that you have to meet. You have to have paid into Social Security, less if you're younger, but usually 10 years, 40 quarters. And you have to be currently insured. That's what a lot of people mess up is they say, hey, I was denied for disability, but I paid into Social Security for 10 years. But that was 10 years ago and you haven't worked for 10 years. So Social Security also has an eligibility requirement that you had to work 5 out of the last 10 years. So some people, unfortunately, can't get disability because they didn't work 5 out of the last 10 years. Janet, I figured it myself and I was within $40 of their calculation due to it starting a few months earlier. Had a great Social Security agent. I figured it myself and was within $40 of the count due to starting a few months earlier. Had a great, yeah. So you did it yourself. Yeah. And Windexing. But he had a great Social Security agent. So that's good. Yeah. I think a lot of people are missing, the Social Security employees are missing that Windex PIA. And $40, $60 a month difference if they use that. If my wife younger and collects Social Security at 62 and 2 years later I retire at 65, will her SSA payment increase if my payment is more than twice the amount of hers? Yes. If your benefit amount is twice, if your full benefit amount is twice as much as her full benefit amount, not what she's currently receiving because she filed early. So if her full benefit amount is $1,000, she's receiving $700. You don't look at that $700. You look at how much her benefit amount would be at her full retirement age, which is called the PIA, the primary insurance amount. So you have to compare your primary insurance amount versus her primary insurance amount. But that's easy to do. Just when you call Social Security and set up an appointment, then you say, is there any money in there for my wife? Do we need to set her up an appointment too? And they'll look at the record real quick and they'll say, oh yeah, there's more money for her too. So let's, set up an appointment at the same time. Usually do it at the same time. So you do your retirement claim, you hand the phone to your wife does a spouse claim, and you go on with your life with your wife. Let's see. Fernando, my daughter has SSI. Will her benefits and state home services, my spouse's or caretaker benefits change? Yeah, SSI always changes, based on income and resources, and it changes every year. It goes up every year, never to how much it should be. But yeah, it increases. If your daughter has income coming in, then they might offset that, your SSI, with whatever income comes in, because SSI is the welfare-based program. So let me see here. I got a question. All right. My husband passed away in 1991. He was 51 at the time of death. I received my retirement and his survivor benefits. Should I check on indexing? I'm 77 years old. In your case, probably not. Well, it depends on which benefit is the higher. So if your retirement benefits are the higher amount, and then you just happen to be, you filed for survivor benefits at first, and then you started filing, and then you started receiving retirement benefits, your retirement benefits are the highest. So right now it won't make a difference, but when you were receiving survivor benefits only, it might have made a difference. But if you're receiving retirement benefits and on top of that survivor benefits, then yeah, I would definitely check and ask. Yeah. Sorry if that was confusing, but it depends on what started. Yes, I would definitely call up and say, hey, I'm receiving survivor benefits and he passed away before the age of 62, and was my PIA calculated using the Windex PIA? And the person on the phone will be surprised you know about all that, and then they might be, if they're a new employee, they'll be, okay, well, I don't know, I don't know what you're talking about. Let me check it out, and just yeah, hopefully get you some more money. And again, if that it was an incorrect calculation by the Social Security Administration, and you've been getting your benefits for 5 years, then what they should do is give you that back pay. So if it increases your benefit $60 a month, then they'll give it to you for 5 years. So yeah, come back here and tell us how that went, Beverly, please. So call up Social Security this week, next week, and get on the phone and tell them about that, and come back here and please let us know how that goes. At 62, can I collect SSI first to wait? Okay, you're talking SSI is the welfare. You're just talking about regular Social Security. Can I collect Social Security first to wait to begin collecting X's Social Security? Partially collecting U.S. Air Force full bird colonel. Full bird colonel. Wow. I was a stay-at-home mom, wife, expecting limited FICA myself. So, can I collect Social Security first and begin to collecting X? No, when you start your benefits, it's called a deemed filing. So when you start your benefits, you also have to file for any other benefits out there. So you have to, if your benefit amount is less, you go ahead and file for your benefits. And then if your ex's benefit amount is twice as amount as yours, then you go ahead and start those benefits at the same time. Unless your ex is deceased. But I don't read that in there. So if it's deceased, if you're filing survivor benefits, you do not have to file for your own benefits first. You can just start the survivor benefits and then switch to retirement later, or start retirement on your own and switch to survivor benefits later. So calling Social Security sounds easy, but I've got 5 different answers from them regarding my my estimated retirement amount. Yes. That's you will never get a definitive real number until you actually file a claim, because all kinds of different variables. If you're receiving a non-covered pension, you definitely won't get a definitive amount until you file a claim. So, and then how far out you're looking. If you want to find out how much your benefit amount will be in 2 years or 3 years or 4 years, then the estimates are going to be different because your work history, projections are going to be different, all the rest of it. So if you're 62 and you want a 100% definitive amount, then you don't talk to just the person picking up the phone. You need to set up an appointment and talk to an actual, it's called a Title II claim specialist, an actual retirement expert. And they will give you the definitive amount. And at that time, if you don't want to start your benefits, then just tell, oh, okay, well, thanks for the number. I'll start my benefits next year and I'll come back then, and no harm, no foul. All right, let's see what else we got there. Questions. Going through TikTok here, trying to show some love to TikTok. I'm getting survivor benefits when I turn 62. Can I get mine too? Yes, if your benefit amount at 62 is more than your survivor benefits, what will happen is you'll continue to get your survivor benefits plus the difference. So if there's an extra $100 from your own benefits, so like if your survivor benefits is $900 and then your benefits on your own record is 1,000, then you'll get 1,000. It'll be $100 plus you'll continue to get the survivor benefit. So you're kind of technically getting 2 checks, but it's one amount. However, 62 is the earliest reduction. So you're getting a 30% reduction on your Social Security on retirement on your own. So you can start it. If that's more money, you need that extra money, go for it. But understand that if you let your benefits continue to increase every month you wait, your benefits increase a little bit every month. So you might say, well, yeah, I need the extra $100 now, but if I wait until 64, 65, 66, I'll get an extra $200 or extra $300. So I would definitely, check out the numbers and see what is best for you. Heartbeat. You can only receive survivor benefits divorced if spouse earns twice as much as you. Incorrect. then you can only receive the amount that would be highest, not both. Um, Incorrect again. So survivor benefits, divorced spouse benefits, the surviving divorced spouse benefits, it's not the 50%, it's 100%. You can get up to 100% for survivor spouse benefits. And then, yes, you get the highest, but you do get both. So if you're currently receiving, as I just said, if you're receiving $600 on your own record, and then you're entitled to $1,000 from your deceased spouse, then you'll continue to get your $600 plus $400. So yeah, you can't get both in terms of you can't get $600 on your own plus another 1,000 for a total of 16. Yes, that's correct. But you do kind of get both. It's just one minus the other. Yeah. Let's see. Last live stream, you mentioned the reduction $1 per $2 over earned income for surviving spouse with zero payment first X month of year as a result. But how do they predict how much over? You tell them. Yeah. I've taken hundreds of thousands of survivor claims and spouse claims and retirement claims. And that's the question. Are you currently working? Yes. Are you going to make over $22,320? Yes. I've made $1 billion up until this month. Okay, but you're going to start your Social Security benefits next month. Yes. Are you going to work? Are you going to earn $1 billion next month? No, I'm going to stop working. I've got enough money. I'm going to stop working, or I'm going to stay under the monthly limit $1,860. So as soon as you say that, then the Social Security employee goes into MCS, the NSM screen, and he clicks in XXXX for the rest of the year. And that way, those are non-service months for the rest of the year. So that's how they find out. All right. So you tell them. And if it turns out that, later on that wasn't the case, then you'll receive an overpayment letter. So I am on disability and just moved to a new state. In my new state, I am not dual eligible. I am SLIMB. Yeah. The spend down difference is 223. Should I get other Medicare insurance on the side to qualify for dual? Yeah, if you don't qualify for dual, getting other health insurance won't help. You're dually entitled depending on the state. So if you have Medicare and Medicaid, and your Medicaid is one of the higher levels, then you're technically dual eligible. But in terms of getting one of those Medicare Advantage dual eligible plans, you have to have a higher level of Medicaid, and it sounds as though you probably mean SLIMB, SLMB. Yeah, it depends on the state. That SLIMB sometimes that doesn't qualify. It depends on your state for the Medicare Advantage dual eligible plan. You're probably trying to get that as the extra dental and the extra flex card for the groceries and over the counter type stuff. Then that's good. But yeah, if you want, email me, call, and say, hey, I just moved to a new state, because you'll need a new Medicare Advantage plan anyway. So there's that. And remember, well, if you're on Medicaid, you probably won't be able to, fit a Medicare supplement into your budget. So Medicare Advantage is your best option. So have an appointment for SSDI. I am 63, flight attendant. Been off work for numerous injuries since October 2023. I cannot return to that job. Don't feel as though I am trainable in other jobs. Yeah, it was just an article in was it the Washington Post about flight attendants. $24,000 a year and a half. Yeah, that's terrible wages. All the garbage you have to put up with. Yeah. But yes, make sure you watch the videos. The videos I just popped up there, and that'll give you all kinds of tips, tricks, and secrets. Hiring a lawyer, you can if you want. I don't recommend it for the first couple of stages because it's pretty easy, and if you hire a lawyer, then you have to pay them a whole bunch of money if you win. One thing you should watch out for, because I always recommend, if you're going to file for disability, do it online. Why? Is because you're not rushed. You can get all your medications, all your doctor stuff, get a cup of coffee, sit down there for 2 hours and fill it out. when you have an appointment with the Social Security Administration, unfortunately, because Social Security is a 27-year low in staffing, that person probably has 10 other appointments after you, and so you might be rushed a little bit. So I'll just tell you, um, they're given like 45 minutes to an hour to take a disability claim. So as soon as you start, you know, an hour later they have to go on to another disability claim. So you might get rushed a little bit. So if you feel rushed, then tell them, hey, you need to cancel your next appointment. I've got more stuff to tell you. So, but still stay on point. They don't need a super long story. They're not the doctors. So you just the facts, ma'am, as the old Dragnet or Adam 12, whatever it was. So, okay, I think it's the same question. My daughter has, maybe you asked it differently, or will her benefits and home services, my spouse has a caretaker, change if either of us start collecting Social Security? Okay, so that's the question. If there's other income coming into the house, possibly. That's, yeah, other income. But well, yes, it will change, because if you start collecting Social Security benefits, your daughter has to file for benefits on your record. If she became, if she's under the age of 18, she can get auxiliary spouse child or auxiliary child benefits. If she became disabled before the age of 22, and that's why she's receiving SSI, then she's entitled to disabled adult child benefits on your record. So yes, when you or your wife start receiving Social Security benefits, they will ask you those questions, whether you have any children that are entitled. And if so, they will take a claim. And then if she's receiving $943 from SSI, and then she's eligible for $1,000 from you, then essentially her SSI will stop. Her Medicaid, depending on your state, might continue. Usually it does. Derek, I'm on SSI and getting Social Security. I have Medicaid. I'm 64 in November, be 65 if the Lord's will. Yep, all of us. Will the state Medicaid pay the Part B of the 174? Yes, if you're on SSI, then you're probably going to be at the higher levels of Medicaid. And then when your Medicare starts at 65, then they have that Medicare savings program where Medicaid will pay your Part B premium. So yes, and then because you're now going to be dual eligible, you can get a Medicare Advantage dual eligible plan. That's the one with all the extra benefits and bells and whistles, depending on your particular area. So reach out to us if you want. If you have an insurance agent or broker that you know and trust, reach out to them. But if you want, reach out to us and we can find you a Medicare Advantage dual eligible plan and see if we can make your life a little bit easier. One thing I will caution is that you're talking 3 computer systems. So when you start your Medicare and the state Medicaid office will pay for that, that's fine, they will. But you're talking about a Medicaid computer system and a Social Security computer system and a Medicare computer system, and all those 3 systems have to talk to each other, and they often don't. So for the first month or 2, they might take that $174 out of your paycheck. But once the systems talk to each other, then they'll start paying it, and then they'll pay you back that $174 for however many months they delayed. So, but keep up on it, say, hey, I just want to make sure you're going to be paying it. Because sometimes you think, oh, okay, Ed told me to just wait a couple of months, and they'll continue to take it out. But sometimes they mess up completely. So, pretty soon call them up and say, I just want to confirm you are going to pay my Part B premium. And they'll say, oh, yeah, you've got the correct level. And so, yes, we will pay for it. So I says, okay, I'm banking on that. I need that $174. So my attorney said that his fee can't be more than $7,200 if I win SSDI, but SSA allocated bigger amount, 25% of back pay from my award. Will attorney get the whole withheld back? No, they can get the higher of the 2. So 25% up to $7,200. So sometimes 25% is the attorney only gets $3,000. But if you get a $100,000 check, they can't get 25,000. They can only get up to 7,200. And next year it's going to be increasing as well, because attorneys, fight for that increase. So, Um, but sometimes attorneys, they get paid above the 7,200 because they they say, well, we had other fees of copy fees and travel fees, and sometimes they do that, but not often. So it depends on your attorney. Are you planning to do a video of average timeliness of different Social Security processes, filing for retirement, survivor benefits, spousal benefits? No, probably. Yeah, I talk about those on a regular basis, but probably not a separate video because they change all the time. And but yeah, filing for retirement, if everything is good, I've taken hundreds of thousands of retirement claims and finished those in about 20 minutes, and push the button, adjudicate the claim before the person walks out of the office. Survivor benefits, same type of stuff. Spousal benefits, the easy, easy, easy. If everything is good, if all the earnings record is correct, you got all the proofs that you need, there's no strange, weird calculations, you're not receiving a non-covered pension, then if it's just a simple run-of-the-mill retirement, survivor, spouse benefits, you know, within an hour, everything is adjudicated and done. Unless the person taking the claim is a new employee that has to have all their cases reviewed, then yeah, that puts it. And disability, 6 to 9 months. So learn from watching your channel that I'm eligible for a dual eligible Medicare Advantage. I have Medicare and Medicaid. Yes, yes. So hopefully our people or someone was able to help you out and get those benefits. The important thing on that is there's so many people that get those extra benefits, dental and over the counter, and the help with electricity and all that kind of stuff, and they don't use it because I don't know, the insurance companies, whatever company you signed up with makes it difficult to use it, or the over the counter is just aspirin and that's it. And yeah, so but CMS Medicare has came down and they made a new regulation starting next year, June of next year, the middle of next year. The Medicare uh, Advantage insurance companies have to send you a letter that says, hey, you've got $4,000 of dental, and we just want to let you know you haven't been using it. So just want to let you know you got it. Hey, you've got $300 of over-the-counter drug benefits every month, and we just want to know you. So that's one of the reasons why next year in 2025, Medicare Advantage plans are really, really going to change. That and other reasons, because these companies don't get to be billion-dollar health insurance companies because they give out stuff for free, right? So more people are going to be using those benefits because more people are going to be aware that they have them. So Medicare insurance companies are going to start cutting back on other things, and they're hoping you don't check your plan and you just stay with your plan because, hey, I like this plan. I've got my doctor at 0 premium, so I'm just going to stay with it. And then, yeah, but you're not staying with it. Your plan changes December 31st. You probably still have your same doctor. You're probably still 0 premium. You still got your same little card there, but everything under the hood probably is going to change for 2025, and you don't know until it's too late. So make sure you check, and you'll receive the annual notice of change next month. That'll tell you all the changes for 2025. And if you want to go over reviewing that, make sure you give us a call, and we'll put you on the list. Let's see here. My wife is 64. She does not work. If she files to start collecting Social Security, will they use my income against her benefits, even if I have not filed for benefits? Nope, not at all. Her benefit amount is based on her work record. And if there's any, because she's filing early retirement, if there's any reduction, that's also based on her work as well, not yours. So you're looking at what's called a split strategy, where she goes ahead and files for benefits on her own record, starts getting that money going. And then when you file for benefits later, I assume yours is the higher benefit amount, then she will file a spouse claim if there's any more money available there. Learn from watch. Okay, that's thank you. When I switch plans, do I have to inform my current plan? No. When if you get a Medicare insurance broker to help you out, when you file for the new plan, all those things are transmitted to CMS Medicare, and then Medicare notifies your other plan that they have been unsummarily dropped. So unceremoniously dropped, I guess is the word. Linda, I went on Medicare Advantage. I went on a Medicare Advantage PPO September, then full dual Advantage HMO in February. If I have to want or go back to plain Medicare, can I, and when should or do I have to? Um, yes, you can go back to go back to regular Medicare and get a Medicare supplement, but you have to wait because all these plans are good for 1 year. You have to wait till October. But if you're on a full dual advantage plan, that means you're receiving Medicaid, and you cannot sign up for a Medicare supplement plan if you have Medicaid, because you know a Medicare supplement plan is supposed to cover all of the charges, like the 20% of Part B, the co-insurance. But since you have Medicaid, they don't have it. So, Medicare supplements would love to do that because you'll pay a monthly premium and they don't have to do anything. So Congress or CMS said, yeah, no, yeah, nice try, getting that free money. So no, you cannot get a Medicare supplement. If you stop receiving Medicaid, then yes, you can. It depends on if you might have to go through health underwriting and everything, depending on your age and your state. How can I find my ex-husband's social security number? Was married and he disappeared on me. Yep, just call Social Security, the 800 number, and give them as much information you know about him. They won't give you his social security number, but they'll tell you whether there are any extra benefits there. I am disabled and stopped working June 2024. Should I wait 6 months to file? No, no, file now. Run to the computer. You're already on the computer, but run to another computer and start filing. I believe I need more medical documentation from. No, you do not. No, you're losing a lot of money. Please watch my videos. But no, immediately, it's at the end of the month. So I would do it immediately, if not sooner, because if you go and you wait till September, then you might lose a month of money. So start the process now. If you don't want to do it online, call the 800 number now, immediately. And that way you're protected for August. If you wait a few days until September, then again, you might lose the August money, a month money. But no, documentation. When you file for Social Security, part of the application process, it asks you what doctors you going to, when did you see him, what did you see him for, and stuff like that. And Social Security, an agency, DDS, it's called Disability Determination Services, they get the medical documentation. You do not have to provide anything. So no, file, please hurry now. Because number one, you're going to have to wait 6 to 9 months for a decision. And the longer you wait, the more money you're going to possibly lose. So please, they can figure out your social security number. I don't think you have to provide. Yep. Yes. Yes. Robert. What's up, Robert? I went on Social Security at my full retirement age of 66 and 4 months. My wife is not on Social Security yet. Her full is 66 and 8 months. Yeah. So Sheena's, yep. So she files. And then if there's any money left on your record, then they will take a spouse claim. This may sound like a silly question. Let's see here. And what's the difference between SSI and your Social Security retirement benefits? Nope, not a silly question whatsoever. SSI is supplemental security income. That's the welfare-based program that Social Security also administers, celebrating 50 years this year. It was started in 1974. Social Security was started in 1935. So that's what you pay your FICA taxes for, retirement benefits, survivor benefits, spouse benefits, Social Security disability insurance. You get SSI if you're under 65 based on disability. You can also get it based on, it's called SSI aged, those over 65 years old. I'm on SSDI and I go back to work while I still have my SSDI check. And how much can I make? I get $12.33 a month. I want a driving job. Yeah, as long as again, watch my videos I did on all of that. Let me pop them up there again in case you showed up late here. Did you show up to class late, Tommy? All right. Where is it? Okay, so yeah, watch those 3 videos there. Oh wait, I put up the wrong ones. Never mind, not those. Those are the ones for the previous person I was asking about filing for disability. If you're filing for disability, watch those videos. But you asked about working. So these are the videos. Yep. watch these videos. If you're receiving 1233, watch the top one, not the bottom one, because if for people on SSI, the max they can get for SSI is $943. You're not receiving SSI, you're receiving just regular SSDI. So watch the top one, and it goes into all of the details on receiving benefits. Let's see here. Should I call Social Security and tell them to stop my next 4 checks for the remainder of this year and pay back the remaining 1440 owed next April? Why did you work over the annual earnings limit? Maybe that's it. Is that why the checks you think? Yeah, if you're in early retirement and you're going to make over $22,320, then yeah, if you don't want the overpayment, then call up Social Security and tell them, hey, I made $10,000 over, or whatever the case may be, and they will suspend those benefits. If you don't, then yes, you will. Once Social Security finds out, once you file your taxes next year and you notify the IRS, and the IRS notifies Social Security, Social Security will send you that nice little nasty gram that said, "Hey, you owe us $4,573.25, whatever." So, um, if you're asking for a review of your payment, do they stop your benefits while they do the review? Absolutely not. Nope. Your benefits continue. Let's see. I took my Social Security benefits at 64 and a half. The claim rep quoted the independently entitled divorce benefit at 1346 at my full retirement age in November, but half of X is 1546. What would I get? I was told in May 1500. Who's wrong? So yeah, I'd have to do the so maybe yeah, the quotes you get from the frontline personnel, those are just estimates. It's not until you actually file a claim. Once you file a claim, so if this number, the 1346, is a number you got from through filing a claim, then that's the correct one. And it might be, I'm not sure what the $200 difference is Medicare is being taken off, but early retirement or whatever the case may be. Yeah, so when you call the 800 number, just walk into an office and talk to what's called a customer service representative, then they give you an estimate. But that's usually pretty good estimates, but you won't get a 100% definitive amount until you actually file a claim. Leslie, I'm thinking about filing for Social Security in December. I will be 65. My husband is a higher earner, but he will be filing in 3 years. Will I be able to file under his in 3 years? Yep. If his benefit amount is twice your amount, yep. And remember, you're 65. So if you have health insurance through work, your work, or his work, current work, and if yours or his employer has 20 or more employees on that plan, you do not have to sign up for Part B of Medicare. You can hold off until you stop receiving health insurance from current work. But if you don't have health insurance from current work, yours or his, then you have to go ahead and sign up for Medicare Part B. If you sign up for monthly benefits, you're going to sign up for Part A anyway. A is automatic when you sign up for monthly benefits, but B you can delay. And A is free anyway, but B is the $174.70. No use in spending that money if you already have health insurance. My son is on SSDI. He's divorced, one child, living with ex-spouse. Daughter was 17 when Social Security disability began. Checks deposited in mom's bank. Wow, there's a lot of. Now child is 20. Mom refused to give child her past checks. Yeah, that sounds like Social Security really can't do a whole heck of a lot. You can try for Social Security, but yeah, that sounds like a family court type of thing, back pay. Yeah, that sounds, someone's got to file a lawsuit on that. It looks like against the other person. Okay, someone has answered somebody else's question. My Wi-Fi eligible for Social Security because she has no credit and she's back turned 65, but should be able to get Medicare. Um, I'm Wi-Fi eligible. No, I'm not sure what Wi-Fi eligible is, but for Social Security because she has no credit. Okay, so your wife, I guess it might have been a autocorrect spelling wife to Wi-Fi. Anyway, your wife eligible for Social Security because she has no credit. Okay, she is not eligible for Social Security because she has no credit. Um, but she should be able to get Medicare. But if she didn't pay into Social Security, then she won't be able to get Medicare either if she didn't pay FICA for 10 years, unless she worked for a state, local, or government entity that didn't pay into the Social Security part of FICA, but paid into the Medicare part of FICA. A lot of people miss that one. But if you're receiving benefits, she can get Medicare on your record, and she can also get money on your record. Let's see. The Title II representative I spoke to gave me $1,300 figure. The Title II rep in May told me about 1,500. Should I make another appointment for a third appointment to see what the number will be? Oh, okay. So a claim hasn't been taken yet. So yeah, you're just getting estimates. So yeah, once you file the claim and they put it in the system and everything, then you'll get the definitive number. Can I receive my deceased husband's benefits at my full retirement age? Mine at 70. Yes, yes. So for deceased spouse, deceased husband, surviving spouse claims, you do not have to file for benefits on your own record first. So you can go ahead and get surviving spouse claim benefits and then let yours increase all the way until you hit 70 years old and then switch over onto your own. So, or any time in between if you want the money quicker. Last live stream, you mentioned about getting a pension and receiving widow's benefits. I receive $63 a month from my husband's pension. Does this affect my widow's benefits? No. If it comes from your husband's benefits, no pension affects it. The only one that does is if you're receiving a pension and you work for like a government entity, not a federal, as federal pays into FICA, but some state, locals, and cities don't. Let's see here. Laura, what's up, Laura? I applied this year for survivor's benefits. I am 64. I am locked into survivor benefits at 71% of my husband's benefit. Should be a little bit more than six. Uh, yeah, if you're 64, you shouldn't have been at 71. If you file at 60, it's usually 71. You should be getting a little bit more than that. Um, yeah, so should be getting more than that. Yeah, Penelope says the same thing, and Penelope's always right. So if you filed at 64, then your benefit is higher than, yeah, 71.5. Yes. Tommy, thank you, and bless you and your family and friends. God bless everyone. God bless America and Texas. I went to high school in Paris, Texas. So yes. Let's see here. I became disabled and stopped working June 24. Should I wait? Oh no, same question here as before. So RD, you shouldn't have typed that question in twice. You should have already been on the phone with Social Security setting up an appointment or filing your claim online, please. And come back here and tell us how it went. Lisa, Social Security suspended my widow's benefits because I'm still working. So suspended until I reach full retirement age or until I retired. I want to work till 65. I'm currently 60. Yeah, yeah. Social Security will essentially stop your benefits based on last year. Um, they will, if if you made so much over last year that all your benefits are stopped, then they will do the same this year until you call them up and say, oh no, I've reduced my work by half or I stopped working completely, and they can restart your benefits based on a new work report that you give them. So let's see here if we got any other questions on the old TikToks. Got a lot of people joining TikTok, but not a lot of people asking questions. So let's see here. Didi, have early Social Security coming in of 764, working, it might surpass the 22,000 allowance this year by 9,000. So that means $4,500 of benefits will be withheld. And if you're receiving 764, then yeah, they'll take, and they can't take a partial month. So if, 1 month they have to hold back $1 for, 1 month, because they hold back all the checks, and then 1 month there's only $1 left over that you went over, they'll hold back the entire check. They can't do like partial, like send you a check for, okay, where you went, this much over. So for this month, we'll send you $763 instead of 764. No, they don't do that. They withhold the entire month. But Dee and the other people that had the same type of question, that your benefits was suspended because of work. Here's what happens. You won't lose, you lose those checks, but you won't necessarily lose that benefit, in the sense that it's called the adjusted reduction factor. When you turn your full retirement age, Social Security looks at your record and it says, hey, your benefit amount is reduced 30 months because you took your benefits 30 months early. But then you went back to work and you worked for 20 months. So you only got 10 months worth of checks. So at your full retirement age, the computer system, this is 100% automatic. The computer system says your benefit amount should not be reduced for 30 months. Your benefit amount should only be reduced for 10 months. So from your full retirement age on for the rest of your life, your benefit amount will only be reduced for 10 months. So it'll take out that 20 months of reduction factor. So there's that. And Didi asks, or should I just continue receiving my checks and wait to send until they send me that nasty gram? It's completely your decision. Some people do that. That's why you always hear, there's a big thing in Congress now about Social Security pays all these overpayments and stuff. And some people, like Didi, just might say, yeah, I'll take an overpayment. And people, hold that against Social Security. Yeah, how come Social Security is paying all these people over? Because, well, some people like Didi, which might be a good idea. Depends. And so, okay, well, I can stop my checks and, have to call Social Security and wait for 3 hours to stop my checks. And sometimes they do, and sometimes they don't, and they mess it up and I have to restart it. But if I just go over, and then when I do my taxes next year, they send me an astagram that, I owe them $4,500. I will just put that money in the bank right now, collect interest, and when they send it to me, I'll just pay them the $4,500. So it's a self-inflicted wound. It's self-inflicted overpayment, and it doesn't affect it. It's not on, it's like back in grade school. It's not on your permanent record that you have an overpayment that they hold against you. Like that spitball incident in third grade. Yeah, if you got an overpayment, you pay it and you're done, and nothing is held against you. It's like happens all the time. So don't worry about it. So, all right, we are over an hour, and wow, I'm gonna have to do next year or next week. I'm gonna be in traveling status. So next week I'm not going to be doing a lot of regular topics. I'm going to jump on several times in the week and just answer nothing but questions. So if I missed your question today, make sure you join me tomorrow, and I'll do a Q&A tomorrow. But next week, I'm going to be doing a lot of question and answer only sessions. So I apologize I didn't get to your question today. Make sure you join me tomorrow or next week